Recognizing the signs and symptoms of illness. Signs and symptoms of illness. Act immediately if your gut feeling or what you observe tells you there is a problem. Call 911 to get help immediately. Common signs and symptoms of illness. Changes in temperature, changes in appetite, changes in moods or behaviors, changes in appearance, change in bowel or bladder habits, vomiting and dehydration, changes in breathing, complaints of pain, elevated temperature, elevated or low blood sugar readings. Changes in temperature. Normal temperatures are 98.6 orally, 99.6 rectally, or 97.6 under the arm. Call a nurse if 100 degrees or greater orally, or 99 degrees or greater under the arm. Changes in appetite. Call a nurse if a person refuses food, fluids, or if they are not able to keep down fluids down for 8 to 12 hours, or if there is vomiting. Changes in moods or behaviors. Tired, talkative, quiet, groggy. Changes in appearance. Call a nurse if a person has a rash that is itchy, painful, or spreading, or if the lips, fingertips are blue, or the skin is unusually pale. Call 911 immediately if the person has bluish color and is having difficulty breathing. The person could be having a breathing or heart problems. Changes in bowel or bladder habits. Changes in bowel or bladder habits such as constipation with or without abdominal pain, diarrhea, not urinating as much, unable to control bowel or bladder or bowel movements. BM is black, bloody, or look like coffee grounds. Vomiting and dehydration. Vomiting can be caused by many different things, including infection, medication, travel, motion, diet, or stress. Nausea discourages eating. When nausea and vomiting continue for a long period of time and the person is not able to keep down enough fluids in his or her body, a serious condition called dehydration may occur. Vomiting and dehydration. Dehydration can be recognized by extreme thirst, lightheadedness, infrequent or dark urine, dry mouth, and decreased skin elasticity. To replace fluids, try helping the person take small, frequent sips of clear liquids or suck on ice chips. Make sure the person takes fluids. This condition requires immediate attention. Take a person to the hospital if they can't take fluids. Vomiting and dehydration. When a person vomits while lying down, turn him or her on their side to prevent choking. Make sure the throat is clear. Aspirating vomiting can quickly cause pneumonia. Vomiting and dehydration. Call a nurse. When vomiting and diarrhea occur along with 100-degree rash or drowsiness, if a person is unable to hold down liquids for 8 to 12 hours, if vomiting or if stools are bloody or black or look like coffee grounds, if there is vomiting along with severe headache or a recent head injury. Changes in breathing. Lips and fingers, nails bluish, blocked airway, stopped breathing. Call 911 immediately. Start rescue breathing or CPR if breathing or heart stops. Complaints of pain. Call the nurse and describe what, describe where, describe when, and describe how long. Elevated temperature. Call a nurse if a person has an elevated temperature accompanied by seizure, stiff neck, and headache and/or abdominal pain. Elevated or low blood sugar reading. Call a nurse for blood sugars less than 55 or greater than 200. When calling a nurse, describe what is happening or what you see. Take vital signs, blood pressure, pulse, respirations. Have a list of current meds available. Know the person's normal activities and bowel movement activity for the past 5 days and description. When calling 911, tell the dispatcher who you are, where you are, location, address, house description. What is happening? Describe the emergency. When did it start? And stay on the phone until the dispatcher tells you to hang up. Preventing spread of infection and disease. Use universal precaution. Treat all blood and body fluids as if they were infectious. Wear gloves when in direct contact with blood and body fluids or contaminated bandages or substances. Wash hands 15 to 20 seconds with soap under running water before and after giving direct care, even if protective gloves have been worn. Place used needles directly into puncture-resistant containers after use. Do not recap, bend, or break. Clean frequently. Touch surfaces with disinfectant often throughout the day. Clean wheelchairs, shower chairs, bedside toilet chairs with disinfectants daily. Medical emergencies. For emergencies or illnesses that are a serious threat to life, health, safety, and welfare for people supported at Babcock Center, call 911 immediately. Example of medical emergencies may include, but are not limited to, heart attack. The symptoms include chest pains, uncomfortable pressure, squeezing tight pain in the center of the chest, lasting for more than a few minutes. Pain or discomfort in one or more arms, the back, neck, jaw, or pain radiating to those areas. Shortness of breath, with or without chest pains. Cold sweat, lightheadedness, and nausea. Examples of a medical emergency: stroke or suspected stroke. The symptoms include sudden numbness or weakness of the face, arms, or legs, especially on one side of the body. Sudden confusion, trouble speaking or understanding. Sudden trouble of seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or coordination. Severe head ache with no known cause. Use the acronym FAST to remember the warning signs. F. Face. Ask person to smile. Does one side of face droop? A. Arms. Ask person to raise both arms. Does one side drift down? S. Speech. Ask them to repeat simple phrase. Slurred, strange. T. Time. Call 911 immediately if you see any of these signs. Examples of medical emergencies: no pulse and/or not breathing, severe shortness of breath or difficulty breathing, diabetic emergencies or unresponsiveness, head injury or concussion, uncontrollable bleeding, fractures or broken bones, severe lacerations or bites, burns, sudden severe pain. Examples of medical emergencies: seizures lasting more than 5 minutes, and this is not normal for this person or has continuous seizures. Recurrent vomiting, severe asthmatic attack when prescribed medication is not working. Code phrase: Call 911 immediately. Who should I call? Notify the assigned nurse during the week or on-call nurse on the weekends, in addition to calls made to residential managers of anyone who sent out for a medical emergency so that the appropriate medical follow-up can be done. Remember, act immediately if your gut feeling or what you observe tells you there is a problem. Call 911 to get help immediately.